Yep.
There we go. Jamie, good afternoon. How are
Good
you?
afternoon. I'm doing well. How are you feeling today?
Good. It's sunny. 13 inches of snow, but it's sunny now, so that's good.
Yep.
And this room gets a lot of sun, so I'm happy.
You know, it's funny because you speak of exercise. Well, snow. And snow, I've done so much exercise. I've shoveled 4 or 5 times in the last 48 hours, which has been exhausting. Uh, and then, but I've been so excited and so motivated by what people are submitting on Facebook
Oh, tell
in
me
our
more.
links. So these were just some of the
Uh-huh.
highlights of things that we had submitted by Monday. And even since Monday, we've had so much more submitted. But these are absolutely fantastic.
Well, hats off to Phil and Casey and Michelle. Well, thank you, everyone, and that's fantastic.
Yeah.
And as people are joining, please say hello and all that. No, that's great. What else are you noticing? What kind of comments and things?
Yeah. So I added a new question to the survey. And so for those of you who have filled out the survey, thank you so much. I am so motivated by you. I asked, what is one improvement you have made in the last week? And somebody actually put something that we talked about last week, Dr. Bhargava. They
Yeah.
bought workout clothes. They bought an
Woo.
exercise outfit, which is exactly what you said. And we've got so many people already saying hello. So hi, Tyler. Hi, Vicky. Eugene, Alden, Casey. Thank you guys for joining in again. I'm seeing a lot of repeat people. I love it.
Shelly was the first one to join. Hello, Shelly. Yeah, so this is fantastic. No, I think here's the thing. I feel truly excited about what's happening. It's on a smaller scale, but the big thing that is happening is the community that we are building. It has been lovely to see people interacting with each other. That has been fantastic. So
Yeah.
I'm just excited about that we did it. And next year it'll be even much bigger and all of that. But hats off to all of you.
Yeah, I like that everybody's responding to each other's posts and you guys are encouraging each other as you're making your lives healthier. And that's awesome.
Excellent. It's about 1 p.m. So good afternoon, everyone, and welcome to our next webinar in this series. And thank you so much for joining. Now, here's the thing. When we think of diabetes, do you know that in 2016, there were 16 million emergency room visits which had a diabetes diagnosis? More importantly, in 2016, and by now, 500,000 people visited the emergency room either for low or high sugar. And that's huge. And that's just tip of the iceberg. That's the people who feel really bad. Now think about the rest of the iceberg where people are going with these peaks and valleys in their daily routine 24/7. That's what we're going to talk about today. So today we are going to focus on sugars. We started with nutrition and activity, and now we're going to blood sugars. How do you upgrade? That's the word we chose. Upgrade your blood sugar monitoring. So we'll have two key things to talk about. How to take control of your sugars proactively, and then what to do when they are controlling you. What action do you take then? So going to be pretty exciting. I just want to introduce myself. I'm Dr. Bhargava, Dr. B, very interested in diabetes since 1994 when I was 4 years old. Just kidding. I have gray hairs now. And everything and anything I do pretty much is diabetes related these days. In our quest to really achieve these objectives today, of course, I'll be joined by Dr. Jamie Pitlick, pharmacist, very passionate about diabetes. Jamie, welcome to our team here.
Thank you. Just wanted to do a quick shout out. Vicky, you said this is the highlight of your week. It is the highlight of our week. You guys energize us. We would not be here and continuing to do this every week if we didn't enjoy this. And so we are so glad you guys are enjoying it with us. As we get started today, I wanted to show some of the progress that we've made as a group. So this is an overwhelming picture. But what I want you to see is the blue bars are how we started on a scale of 1 to 10. How are you doing on your goal that you picked? And this was at week 0. And I want you to see the most responses in the blue bars are at 2, 3, 4. So out of a scale of 10, 10 is you are on track, you are achieving your goal. Now we're about halfway through this January challenge or 6-week challenge, and we're shifting. We're seeing more in the 4s, more in the 5s, 6s, 7s. So this shift is amazing. We're not perfect yet. I don't even think I would ever count myself as perfect. So if you're at 10 and you're 100% perfect every single week, that is amazing, and keep going. I would not count myself there. I want to see the shift go from the 2s and the 3s into the 5s, 6s, and 7s. So this is exactly why we're doing this. And I wanted to show everybody how great you are doing.
Okay, so this is super exciting. Again, if I had to sum it up, pretty much 75% of the scores were below 5, or 80 or 90% of the scores were below 5 in this, 5 and below. And now what has happened is a massive shift where you're seeing 35, I mean 40, 50% above 5. This is a big deal. So guys, congratulations. I am just hopeful that this will last for a very long time. What you have shown is that if you put your mind and focus on it, you can do it. You can improve things. And then, we just have to maintain it. I love the comment from Joy. This is fantastic. Thank you. This makes our day. My doctor, dietitian, diabetic nurse, and I'm so happy. My A1C went from 11.4 in October to 6.7 last week. Thanks for the diet and exercise tips. Well, majority of the work was done by you. If we had a small part in it, we're just elated. So thank you. All right.
We did have a few questions submitted. So Dr. Bergwell, I'll have you take a chance to answer some of these, and then I can give some of the resources that I found as well. Sure. We have a listener who was wondering about the number of eggs that you should eat per week. Is there a general recommendation on that?
Sure. So egg is a great source of protein for sure. It does come packaged with cholesterol too. So, it depends on where you are getting your protein. My best source of protein, the lentils. But then the next thing is eggs. Amazing. Very bioavailable protein, about 6 grams or so. So in terms of the amount, I would say, this is just my thing, I'm not a dietitian, 1 to 2 a day, 2 or 3 times a week. Why limited, even though I love the protein, is the cholesterol. Now, on other days, if you say, I love eggs and I want to do egg whites, I'm totally okay with that. So that would be my answer on this prompt, just thinking out loud level.
And that is exactly on par with what I found from a blog by a reputable dietitian. That source said about 7 eggs per week, and that's the whole eggs. But then if you just wanted to do the protein pack and stick to the egg whites, you can have more of just egg whites, but about 7 eggs per week is what you're looking at. And then this question also went on. So you said your number one way to get protein is through lentils. Her question then went on to ask about beans and lentils. And do you count them as a carb, a vegetable, or a protein?
So first of all, they're not vegetable, but they are a great combination of carbs and protein that are just packaged right. That's how I would say it. So decent amount of carbs, decent amount of proteins. You got to count both. Let's say you're carb counting. You definitely want to count the carbs in your calculations because they will affect them. But it's one of the best package combination of carbs and proteins.
Yep. Next question for the group, and I'll just answer this one. It said they wanted to know, how are we going to keep track once we're done with this challenge? And I'm going to say that's the entire session. That is our last session. So I'm going to save all of my advice for that session, but we'll be talking about it on February 17th. So stay tuned for that.
Let me say one thing on that.
Yeah.
If enough people want this, and you'll have to let us know, we would be willing to build it inside the Iowa Diabetes portal, and it'll be much, much faster. I salute you for filling your surveys and stuff. Thank you. And we can build it inside the portal. It will take us about 2 months to build it, but I just want to see if many people would need it. So reach out to us, say we really, really want it, we'll use it. And if enough people do it, we will actually build it inside. I think for next year, we'll definitely have it inside the platform, but we just have to decide how soon. Back to you.
Yeah. And the last question that we got posted was, what are some easy yet delicious vegetable dishes? So I went out and looked at a couple of different websites and came up with one of my favorite ones that I looked through. And so I do want to provide that link for you guys. So if we can provide that link, it's got about 30 different quick and healthy side dishes that you guys can cook. So please look at that link if you were looking for vegetable dishes.
Yeah, two things I want to say on vegetable. They're my favorite: roasted vegetables or grilled. Oh man, amazing! A few months ago we did a vegetable fruits and veggie thing with Courtney, the cauliflower war. So please watch that. It has some great ways of using vegetables as well. Roxanne, thank you for pointing out the need for people to check, like you were talking about an announcer who needs to check his blood sugar regularly throughout the game. True, many players, I have a patient who plays volleyball and her sugars go up rapidly during competition. So she has to check and use insulin. Vicky, I heard you. You want to continue? Please build it and we'll come. Yes. And if people want it, we will definitely build it. Cool. Back to you, Jamie.
Yeah. To get us started on our talk about our sugars and how to control them, I have a question for you guys. So, how do you test your blood sugars? Let us know how you're testing right now. Are you using a glucose meter, a sensor, or both?
So please type in how you are checking sugars, because the next conversation is around upgrading your sugar checking. There might be a delay in the comments, but yeah. All right, I think, Jamie, we can move on, and I think the comments will start flowing in. So yeah.
Yeah.
Randy says meter.
Perfect. Kathy saying meter. Cassidy recently got a sensor, but she's doing both.
Sure.
Roxanne sensor, Thomas meter, Joy meter, a lot of meters, and a couple of sensors. And I would say that's probably where we are kind of across the board in diabetes. Most people are going to start with a meter. And then depending on, especially if you have type 2 diabetes, depending on what medications you're on, slowly kind of upgrade to sensor if you're needing it. So we're going to talk right now about how to upgrade your testing. And the first way to upgrade your testing is potentially by using a sensor. The technical name for a sensor is called a continuous glucose monitoring. And this is when you check your sugar all day, all the time. So you have this little electrode that is sitting in your right below your skin, and it's measuring the amount of sugar in between all of the tissues right under the skin. That's also called the interstitial tissue. So it's not necessarily measuring blood sugar, but it's measuring in the sugar in between the tissues right here. And
so it's a funny story. Diabetes is all about checking sugar in the fluids. Many decades ago, we used to use urine. I don't know if anybody remembers that or had to do that. Most inaccurate way of doing it, but that was the best we got. And then we moved to blood sugar meters and blood sugars. And now the new paradigm, checking it in the interstitial fluid. It's about 15 minutes behind, always important to keep in mind. Yes. Sorry for the interruption, but I felt the need, the journey of the fluids that we test, from urine to blood to interstitial fluid.
Yeah. And can you imagine diagnosing somebody with diabetes by tasting their urine?
Oh, my Lord. All right.
That would not be fun. But we've got different places that you can wear these sensors, and we've got a couple of different brands. So some of them, as shown right here, can be shown on the stomach, and some can be worn in the arm. And that just depends on patient preference and then where these sensors were tested. It is important because it can show us the complete sugar profile. It's sitting in your arm or sitting in your stomach. and it's testing your blood sugar every 1 to 5 minutes. So there's some of them that are testing every single minute and reporting every minute. Some of the older ones are testing every 5 minutes, but you're still able to get a 360 look at what your blood sugar is. So 24/7, what is your blood sugar in between those, 3 other points that you normally test with a blood finger stick. The other thing that is great, some of these are coming with alarms. And even if they're not having alarms, once we download all of the data from these sensors, we can see what's happening in between your meals overnight. We can see the highs, and for your safety, more importantly, we can see the lows. And really hone in and prevent a lot of the swings that happen in diabetes. So as I'm looking at them, there's many different types of these sensors, and I've got another overwhelming picture for you, but I did want to give you an idea of the 4 different major brands on the market and the differences between them. Because if you're starting to think about these differences do become important. So we've got the Freestyle Libre, Medtronic Guardian, Dexcom G6, and Eversense. And on here, I would say the most popular 2 would be the Libre and the Dexcom. So just some definitions for you. Calibration means, do you have to do a finger stick anywhere from 2 to 4 times a day to tell you how accurate that sensor is? So some of the newer ones on the market, the Libre 2 and the Dexcom, you don't have to do calibrations. You don't have to tell that sensor where your blood sugar is based on a finger stick. There are some other ones that you continue to have to do that. Some, the Medtronic, I believe, is 4 times a day. Eversense is twice a day. Treatment decision. Can you dose insulin based on that blood sugar that you're seeing on that sensor? Or do you have to take an additional finger stick to get a more accurate representation of what your blood sugar is? Remember, there's that 15-minute delay. And so if some of these sensors are not allowed to make treatment decisions based on it. Then I've got how long do we wear them? And then if there are alerts that you can activate to let you know when you're high or low. So those alerts are one of the best features that I like about these sensors, especially of those of you that are on insulins. If you're going low, it's going to tell you, it's going to beep at you, it's going to be annoying. And we want it to be annoying to help you keep you safe.
So, Jamie, I don't know if you mentioned or not, Eversense is the implantable one, and everything else is just put by the patient on the skin.
Right. Yeah.
Tyler has a comment about noticing Dexcom being more accurate. In general, that has been noticed. Everybody is improving, but we also have seen that there's probably a difference. And the newer technologies are pushing it. Medtronic is also making it better.
Yeah, they're always improving. And so I say, as we're getting more improvements, we're seeing better and better accuracy out of all of these. So who do you recommend? I've kind of described these for everybody. Dr. Bhargava, who do you recommend gets a sensor?
Yeah, so first of all, I think it's a major improvement, and I was really involved with this for many, many years. Excited to see like Libre in market and so forth. Major improvement. Instead of just knowing like a static picture, now you're getting the video, the ups and downs. Is it for everyone? In a resource unconstrained world, yes, but we have resource constraints, and sometimes this information is too much. In general, I think of this for people on insulin first. That's my strategy. We can look at in a moment what insurances do and so forth. But in general, people on insulin is my first prime candidate. Those who are taking multiple shots for sure, even basal bolus. The other thing I just want to mention about sensors is it's not just a monitoring tool. It's also a behavioral modification tool. When you see that you ate pizza and your sugars were high all night long, I think you'll think about having pizza next time, or smaller amounts. So I love it not just because it does all this other stuff, but it also really helps modify behavior. So Jamie, that's my simple like people on insulin. But talk about guidelines or insurances. What do they cover?
Yep. And so guidelines and insurances are going to cover something similar. Multiple injections of insulin a day is the slight difference. So 3 or more injections of insulin a day and already testing 4 or more times a day. And so there are like Medicare is going to make you show documentation that you've done it for 30 days in a row. Other criteria are if you get lows, but you're not able to feel the lows, called hypoglycemia unawareness. Or if you are somebody who gets frequent hypoglycemia or low blood sugars. And then pretty much anybody with type 1 diabetes can qualify for one as well.
Excellent. I think so. Here's the thing. Now, this was when we upgrade our sugar checking, there are 2 ways we can do it. And one is you get to the sensors, but as we said, sensors not for everyone or affordable. So now the second thing, apart from checking all the time or knowing all the time, is checking at the right times. And so people would ask me, how often should I check? And I just say one more time than the number of insulin shots you're on. That's just, again, I like to keep things simple. If you are not on insulin, probably once a day or 7 times a week. But you can do them in a way that I really, really like. And that's called the paired approach. And Jamie, I think you have a slide on this as well. So paired readings are very valuable before and after an intervention, typically like before and after a meal, right at the beginning and 2 hours from the start of the meal, before and after exercise. Because Jamie, can you click down arrow one time? Yeah. So it really gives you very valuable information, and that's the reinforcement you look for. Hey, meals make my sugar go up or not. Exercise makes my sugar come down and not. Yeah. When you check once a day or whatever, check different times of the day. There's another one that I really like, the 3x7. So let's say you were seeing your doctor, and 3 days before you realize, oops, I haven't been checking my sugars. What can you do to transform your doctor visit and put a smile on your doctor's face in 3 days? What can you do? That's what I call the 360, which is you check 7 times a day, before and after the 3 meals and bedtime for 3 days in a row. Extremely valuable information too. So I would suggest think about checking at the right times as well. So how many times you check and what times do you check? There's some patients of mine who will keep checking once daily in the morning as a matter of habit. That's great. I do want to know. But do I need to know every day that they are between 110 and 130? So checking at the right time is one important piece I wanted to convey. Jamie, what would you add?
Those are the most important things. I actually follow very similar rules. I like, for somebody who is new to testing, the paired readings before and after different events. So to me, again, those events are meals, exercise, bedtime. And that lets you know how your body is handling sugar over that event. And you can really learn from that. I think if you do it every day in the morning and never check it later, you can really miss how your body is handling food. So I encourage you to do it also throughout the day. Got a question from Robert. He is asking about, he's on a Libre, and he's looking at time and target range. So what are your thoughts on time and target range, Dr. B?
Yeah, so time and range is kind of the new big thing, right? We've always talked about A1C, and that gives us 90-day control. The world is slowly shifting from meters to sensors and from A1C to time and range. The idea is how often, and do we have a slide on this today? There's a slide about blood sugar control. I'll draw home the point that, but many of these sensors will generate this thing called time and range, typically between 70 and 180. And American Diabetes Association recommends 70% or above. So that's a very useful feature as well. And so this is one way of looking at it, that green area. When you are on a sensor, then you want to think about target blood sugar between 70 and 180 about 70% of the time. While we are at it, we can talk about blood sugar targets in general for people, right? So American Diabetes Association, 80 to 130 before meals, ACE, 80 to 110. And then after meals, a little bit higher. I kind of, in the spirit of keeping things simple, sometimes a little inaccurate, but what is easy to remember? I learned this in medical school. There was too much information to remember that my brain could. So I started making these mnemonics and things. So I think of it as 80 plus 40. So 80 to 120 in the morning and around 160 rest of the day. That's kind of what I say. And 160 about 2 hours from the start of the meal, things like that. So 80 to 120 and then 160, below 160 rest of the day. So hopefully that helps. I think we might have missed a poll that you were wanting to do. I'm interested in knowing something about peaks and valleys.
Yeah, no, I think my next poll is, how does everybody treat low blood sugar? It's one of the major complications or major things that happen in somebody with diabetes.
So please type in.
How do you guys treat low blood sugar? Casey says her mom uses juice.
Yeah, so remember, 250,000 or so emergency department visits just because of hypoglycemia. And probably for each of those, there's hundreds that are just at home and handled at home. So just think of the burden of hypoglycemia. And so we're very curious what you do. So Robert just eats, and with an emphasis on tea, like eat a lot. VN, blood sugar tablets. Tyler, package of peanut butter crackers. Some juices and something, and carbs and juice and glucose tablets. So lots of different things. That's great. I think all of us do it differently. But Jamie, let's talk a little bit about now to how to control sugars and especially respond to hypoglycemia. Go ahead.
Yep. And so the first thing that I wanted to share with you guys is the rule of 15. Just remembering 15 grams of sugar. If you're less than 70 and feeling symptoms of low blood sugar, 15 grams of sugar. And examples of 15 grams of sugar are going to be, we heard glucose tablets from, I believe, Vian. So 3 to 4 glucose tablets, not just one, 3 to 4. 3 to 5 hard candies like a peppermint or a Jolly Rancher. 1 cup, which is about 8 ounces of low-fat milk, and then a half a cup of regular pop or a half a cup of fruit juice. And I often tell my patients, and I think we stock these sometimes here, is just the juice boxes, because that's a perfect size to keep around. Put them in the fridge, have them nice and cold. You don't even have to have them cold, but just get those juice boxes, have them ready in that size.
All right. Connie makes my day, says, last time I used milk because I think you mentioned it. Yes, we like milk above juices and pop in general, simply because people overdo juice all the time. Mm-hmm. And it's very hard to overdo milk, especially because it's double the amount and so forth. So yes, we equally fast response, but better. And then it provides some long-term control stability as well. All right, Chastity has a comment around blood sugar 70 to 150, but it goes above 200 and usually back in range. So depending on what you eat, sometimes your sugars will go up in 200s. And we can't be as good as our beta cells. Well, that's our goal. That's our big, hairy, audacious goal, to be like the beta cell. But we are not going to get there, none of us, right? So yes, occasionally it will do that. I would not worry about it. I would modify my diet to include some protein and see if I can make that curve just go a little bit lesser. And I would dose my insulin 10 to 15 minutes before the start of the meal. So those are the things you would do, but sometimes they'll go up. That's the power of too much data, right? A sensor shows you all of that. We never saw that in the past. So once we get to sensor, we also have to learn how to deal with more data.
So we've got some other questions or comments. We've got Connie who says she starts to feel weak at a lower level, like at 105. And I would say that happens sometimes in patients who start with higher blood sugars. You start to feel like you're getting a low blood sugar reaction around 105, 100, 80, but it's not low yet. If it's right before a mealtime, I usually recommend go ahead and start preparing your food and eating your food, but you don't necessarily have to treat it with 15 grams of sugar because you're not to the dangerous low point and where you're less than 70. But having some sort of, if it's not getting a protein-filled snack that has a little bit of carbs, but also balanced with proteins and healthy fats would be a good idea at that point is where you can get like a Built bar, like Connie says, or have those graham crackers with peanut butter or something like that.
Yeah, I think one of the things I do want to caution is when you have something high protein, it's going to delay the absorption of the carbs. It will do more even keel, but in true hypoglycemia, I do like to use things which are not too rich in protein. You know, when somebody says peanut butter with cracker, at least the crackers are carbs, right? So I want a little immediate source of carbs. When it's really packaged in a high protein thing, I just get a little nervous.
Yes. Yeah. When it's less than 70, that's why if you look at our 15 grams of sugar slide, they're all pure carb sources.
Yeah.
We want the fast, quick absorbs and carbs. And Robert does bring up a good point. He's got Gvoke, I would say Baqsimi or glucagon. All are good products for low events if you're starting to feel like you cannot ingest sugar yourself. If you can safely ingest sugar, these are good options for you.
Great. So great conversation. I realize that even though we have only gone through our first objective, we are getting a lot of comments, which is exciting. I do want to make sure we bring home some of the key points of other things, but we'll keep answering your comments. So, Jamie, where are we going next with?
Yeah. So how do you recommend that people proactively take charge of their sugars?
All right. So I think here's the thing. We can talk about peaks and valley, and we did have that conversation just a couple of months ago. But I really think we have to, I mean, life is all about proactive management, right? So how do you proactively control your sugars? Well, a few things. The number one, if there was one line, match your food with your medications. That's really the main thing I would say, like a very simple thing. Make sure to match your food with the medications. So controlling your food, distributing your carbs throughout the day, a more consistent carb diet definitely helps. How many grams of carb depends on many factors, somewhere in the 40 to 45 grams for the smaller meals, maybe up to 60 for the larger meal. But many people consume 90 and 100. So food, what goes in mouth is the most important piece of sugars. But then matching it to your medication, especially insulin, is very important. So I say responding to a high or a low is after the fact. What can we do to prevent them from going high or low? And that's where just the right sync between food and medications, and then also activity. If you're more active, take less insulin, things like those. So that's kind of a nutshell of things I might recommend for proactively managing sugars.
And so this question got submitted, and I kind of timed it right here. This got submitted ahead of time. It's somebody who's working on meal replacements. And so they're trying to replace one meal a day with a bar or a shake. And they're having trouble keeping their blood sugar from going low at night or in the very early morning. They've tried to eat more protein before bed and has also turned down their basal rate, but they're still struggling. And we see that, I would say, in anybody who's making a major life change where they're changing their diet quite a bit or starting to have more activity during their day.
Yeah, so I think without knowing more specifics, it's harder to answer. But in general, I would say is, you keep turning your basal rates down slowly, incrementally, and not just at the time of the low, the previous 3 hours as well. So think about that. Second, think about the previous day. If you have a lot of physical activity previous day, the impact could last for hours, even up to a day for some people, but rarely 8, 12 hours. So keep that in mind. I think you have the right mindset, and being on pump allows you to continue to back off. And then, yes, some sort of higher protein thing makes sense. So it's a constant tweaking, and all you can do is reduce. You may not be able to eliminate the lows, but reduce them.
Yeah. We've got a comment from Vicky, I think, which is very telling right now. She was in the hospital. They gave me metformin in the morning. I did that at home and my blood sugars were high. Then I switched back to taking at night. And her blood sugars are now between 137 and 151 in the morning.
So there could be a number of things here, but I think in general, the 850 milligram dose is twice a day medication. So really, from what I see here, is you're probably not on the right frequency. So do talk to your doctor about that, or go in an extended release version of metformin.
Yeah.
Roxanne has a question about exercise in relationship to when I eat. Jamie, what's your favorite thing there?
My favorite thing there is I think that you should never be too hungry when you are working out. But you also don't want to work out immediately after you eat because you feel the heavy stomach. And then it almost makes it worse because when you work out, your blood supply goes away from digesting your food and then goes to your muscles. So it sticks in your stomach longer and you'll get an upset stomach feeling. So a good hour, 2 hours after you eat is generally a good time for me personally. But I know some people that can wake up and work out fasting. I always have to have just a little bit of something.
I'm one of those. I have to exercise fasting. Yeah. Shelly had a question. What if you like or need to eat small meals throughout the day? That kind of throws out the checking your sugars every 2 hours. What should I do? Yeah, so small meals are a little bit harder. It can be done. A sensor is a good answer where at least gives you the time and range for those things. The other thing you can do is the fasting, at least a bedtime, and then do wherever you can through the day. But I can see your trouble, but I think sensor would be a good answer.
Yeah, I agree. Sensor. And then I am a big fan of eating small meals throughout the day. Generally, you don't have as many peaks and valleys with some of those. If you can work it out, it can be pretty even. Have another poll for the group, I believe.
This one, yeah.
Yeah. How often are your sugars in your target range?
So the 70 to 180. Think about that. And you can use a percentage. You can choose one of these choices, but it's just helpful to know. And while that's coming, Jamie, what more would you like to talk about?
Yeah, I think at this point, it's just making sure that we start to understand how to start to control those peaks and valleys. So when you're feeling high and have the high, do you know how to treat it? Making sure that you're if you're on insulin, you know how to get that blood sugar down. If you're not on insulin, are we increasing the water intake and increasing the activity level? So we did an entire talk that was devoted to peaks and valleys. So you guys can refer back to that. But we just wanted to bring a little bit of those concepts back.
Yeah, I loved how you had the mnemonic last time, the 5 S's of high sugars: simple sugars, skipping your medications, sickness, stress, and steroids and other medications. So just keep that in mind when your sugars are high. Run through this thing. Am I consuming too many simple sugars? Am I skipping my medications? Is a sickness coming? Am I stressed? Or am I on a medication that raises my sugar? I do see the comments. Thank you for those. 65 to 70%. Most of the time, rare, never. So smattering of answers. And the main thing I want to say is wherever you are, in general, you can do better. It does require focus. Diabetes is a 24/7 disease. So I do feel for you guys. And I see that at home with one family member with type 1. It is a truly 24/7. Just do the best you can. You're not trying to be perfect. You're not trying to mimic nature, like being just like a beta cell, but you are always striving in that direction. On the low side, just be proactively planning to prevent the lows. Just think about, are you going to make sure you have food at the right times? You delay too long and you have lows. Is your medication dose too high? Did you do excess activity? One day you felt, I'm going to walk 5 miles. Then be proactive. The alcohol and diabetes don't get along very well. Alcohol inhibits the liver from producing sugar if our sugars go low. So be very watchful. Jamie kind of talked about the rule of 15 grams of carb, and then wait 15 minutes and check. If still low, repeat. That's a general guideline on the 15. So those were some of the highlights from the peak and valley. It was a great conversation. I would say go back and listen to that if you want to know more.
Yeah. At this point, I think there's a couple of things that we can talk about. Just to give you guys an idea, if you're really struggling with the peaks and nothing that you're doing seems to be helping out, do reach out to us. We've got a number of research trials that are going on. We've got some new insulins that they're trialing. So if you have type 2 diabetes, we're doing a research trial with a once weekly insulin. But it would only be for those patients that are not on insulin currently. So there's options for you, and we can have discussions with you as well.
It's cool that you can have a weekly insulin. I mean, I'm just very lucky I've been researching not one, but 2 weekly insulin. So if any of you are where insulin is the next step, think about getting a weekly insulin in a trial or Tresiba. So that's really cool. You can visit our website or call our number, and we can pass those number as well. I do want to show, a couple of things that are relevant to blood sugar conversation today. Really, one of the things you can do about your sugars, especially if you are on a meter, is you can track them in Iowa Diabetes Portal. And it's a manual entry. But on the other hand, what happens is once you put your sugars in, you are then able to see the sugar graphs in a really cool way, where it can show you, hey, how good, bad, ugly, green, yellow, red. And it kind of gives you a time in range, a poor man's time in range for all of your sugars and also for different times of the day. So this is a great tool that you can use now because it really takes the information that you're generating, the data you're generating into information and actionable information that you can use and your doctor can use. So definitely use this. You can also connect a bunch of your meters through the platform as well.
Hey, Dr.
So,
Barkova, can you
yes.
click on My Food? Carla is asking how to record food in the portal.
Okay.
So my understanding is you cannot record food directly into the portal, but if you're using something like MyFitnessPal, you can then connect your account with the portal.
When we made it, we realized that all the beautiful diaries had already been created, and MyFitnessPal and Fitbit are 2 big ones. So we have connected those. So the idea is, our goal is to display. We try to connect as many things. So if you look at activity, we connect all sort of trackers as well. So I would say get an app. Most of them are free, and start logging and make sure to connect those through the portal.
And then Tom is asking if the once weekly insulin is similar to Tresiba. And I would say Tresiba is a once daily. It is longer acting than some of the long acting insulins that were out prior to it. But this new one that you guys are studying is even longer acting because we can't do Tresiba once a week.
Yeah. Tresiba is longer than once a day, but definitely much lesser than once a week. So quite a bit of difference.
Okay. The last little bit that I wanted to understand from you, Dr. B, is what are your 3 big takeaways from today?
Well, I think the first thing is upgrade your monitoring, is what I say. Either you use a sensor and kind of know and check all the time, or check at the right times. Second thing, proactively manage your sugars. Mainly your nutrition and meds be in sync. That's another thing I would say. And lastly, be ready for those peaks and valleys. The guideline around 15 grams of carbs. So those are 3 things I would say. The biggest thing I would say is, for me, the most heartening thing today was this one. When you finally know you have impacted one life, it's a big deal. If somebody said, hey, because you said milk, I use milk, or because you said this, I'm doing this, that makes all the effort worthwhile. It takes a lot of work to bring these to you guys. I'm just happy each time I come here. And when somebody says I changed something because of something I learned here, I just love it. So that's kind of my final summary there. Yeah. What about you? Is there any other key points you want to emphasize apart from the 3 I mentioned?
No other ones to mention. Just want to wrap up a few other questions. I've got Thomas who said, no, he was meaning Ozempic. Ozempic, you're right, is once a week, but it is a different drug class. It is an injection, but it is not an insulin. It's a GLP-1, so a non-insulin.
Now, somebody did calculate their cardiovascular risk score, and I want to just spend a minute on that. This is a really cool feature. We just launched in January as our new year thing. When I'm treating people with diabetes, the focus is glucose, of course, but I focus on two things. Immediately, it's your glucose. In the long run, most patients with diabetes will die of heart attacks and strokes. 60 to 80% will just go because of that. So I find this extremely important. The beautiful thing now is you can calculate your own and then have a conversation with your doctor. Hey, my 10-year risk is this. What should I do? So this is a big deal. And maybe one day, Jamie, we should talk about it. But I'm glad somebody noticed it. There was a question there as well.
And then how can you reverse it? So there are some things in there that you can't reverse. There are some things that you can. Things that you can't reverse or change: your age, if it's looking at your race or ethnicity, you can't change some of those factors. You can change your blood pressure. You can change your cholesterol. And so those are the factors that we've got.
Quitting smoking, big deal. Yeah.
And so those are the factors that we've got to work on and look at, those things that we have control over changing.
And guys, if many of you want, eventually we can have my goals here. That'd be really cool, because here's the other part of it. Once you do goals inside the system, a lot of things will come automatically, and you will come to your dashboard and say, you know what, last week was a good week. We can make all those things happen. We just need an active engagement and participation, which we are seeing plenty of. Well, this is filling my bucket. So guys, thank you for filling my bucket today.
Yes. And Cindy, we did an entire talk on Ozempic. If you go back in some of our records, we did an entire talk on this drug class GLP-1s. So it's an entire half an hour. I could spend an hour on that drug. But do look at our past videos on that. It's a good one.
In a nutshell, it improves the communication between intestine and the pancreas. So pancreas produce more insulin and less of hormone called glucagon. It also slows emptying of the stomach and tells the brain, the satiety center, that we are fuller faster. So it reduces not only your sugars, but your weight and also your cardiovascular risk. So it's kind of 3-in-1. Very cool stuff. All right, guys. Thank you, everyone.
Let's do a couple of last minute announcements so that you guys can get credit for this next week. So remember, we're in this middle of this big old challenge. So this week is all about your blood sugar readings. We want to see you take a picture of a reading that you're proud of. You don't have to zoom in on the reading. We don't have to know what it is, but take a picture from afar of either your sensor or your cell phone or your meter, and post it to the group. And tell us why you were so proud of that blood sugar. We want to know and celebrate that success with you. Again, just some reminders that fill out the survey. It's going to be sent every Tuesday, and keep posting with us and keep working with each other. We'll be here every Wednesday. Next week is all about meds. So we're going to help you master your meds so that you can know the 5 things you should know about all your medicines, how to organize your medicines and stick to that schedule, and then talk about the Fabulous 4.
Excellent. All right, everyone. Great conversation and participation. You are a selected group of people, right? You selected yourself to come in these groups because you are proactive. You want to improve your life. You want to improve your diabetes. You want to live a healthier life. We are grateful to be part of that journey and quest. Have a good week.
And just remember something brand new. We tried it last week. Do tell your friends who may have missed this, or anybody that you think may benefit from this. We're going to be re-showing this at 7:30 this evening, and Dr. B and I will actually be on and chatting with you guys in the chat. So share this with people. We want to continue to help as many people as we can.
All right. One last question, Vianne, about the frustration with high blood sugars. One thing to take so less, some comfort would be time in range. Look at your time in range. If you are above 70%, you know that you've reduced your risk of complications. You know, that doctor from Atlanta, Avian, who came by, looked at you and said, you're not going to get complications. You're not. With how long you have had it and so forth. So just keep that in mind. The different insulin pumps, it's a major decision. Will it especially impact that? I can't say that. If you're not on a fast enough insulin, see which insulins are approved for your pump and think about that as another option. But at the end of the day, you're doing great. Just know that you're doing awesome. All right, everyone, great day.